Doc Hamels, and this is another Chautauqua Strong moment. Today we have Dr. Robert Berke, who's a county physician, who's going to give you a physician's point of view during this coronavirus crisis.
Thanks, Doc. Good morning, everybody. I think I'm going to start with what we do know. We know that there is a worldwide pandemic with a novel or new virus that probably originated in a bat. The problem with new viruses is that humans at this point don't have any immunity. And this is why we're seeing the worldwide spread at the rate it's going. We know that people get infected with droplet infection, spread person to person with coughing or sneezing. The virus enters through your respiratory tract, upper respiratory tract. You have a little cold symptoms, sits there for 7 to 14 days, and then 80% of the people just do fine. Unfortunately, 20% of the people get more sick.
Oh boy.
The virus goes deeper into the deep parts of the lung, and some of those people get very, very ill. Unfortunately, the people at highest risk are the elderly, people with underlying conditions, especially pulmonary conditions, but other conditions as well. People who are immune suppressed, undergoing chemotherapy for cancer, have chronic obstructive lung disease, smokers, vapors. We're seeing that up to 40% of the hospitalized people in the United States and in France at the moment are under the age of 55, and many of them are under 40 and have a history of either smoking or vaping. So that's what we do know. We also know that the most successful treatment for this at the moment is just support. There is no medication. We've seen reports of hydroxychloroquine, however. These are very, very small studies and have not been proven out in large-scale studies. So basically, support. The other thing we do know that the success that countries have had is with social distancing, keeping people away from each other. And this is why you've seen in China the huge lockdown, and now around the world you're seeing, and obviously in the United States, efforts to keep people from congregating in large groups or even in small groups. If you're unwell, we know you distance yourself and just stay secluded. What we really need people to understand is there are some don'ts when it comes to this illness. One is congregation with other people. 2, flooding the emergency room, 911, urgent centers, for all the things that people seem to like going there for, rashes, minor colds, earaches, whatever else. These are the people that are going to keep you alive in the long run, and you're going to destroy that fabric of our community if you flood these places with calls, with non-emergent conditions, and also potentially if you're sick with this illness. Your best bet is to stay at home, and the do's are very simple. Pick up the phone, call your physician. I'm part of a group of physicians. Actually, I'm meeting again this afternoon. And we talk about what to do to use the telemedicine, telephone call interviews with patients to ascertain what is going on with them. Also, we are attempting to keep as many sick people. This is counterintuitive for physicians. We usually see sick people. Now we don't want them commingled with well people. So we want to treat them in their homes if possible and make decisions based on like we always do, based on their history and what's going on. If they're just well but worried, that's fine. If they're in need of a routine visit, we can either deal with it with telemedicine or bring them into an office where there are no sick people coming. If you commingle sick and well people, you get what we are going to get. The next thing is, if they're sick, they stay at home. If they're really sick, then we talk about getting them to a place where they can be tested. Test supplies are in very, very short supply at the moment. They're to be used mainly for people who are in institutions where they want to make sure if the person is sick, they will segregate them or quarantine them, and for medical staff. History shows that the majority of cases, or not the majority, but 40% of the cases in China were caused by medical staff who were sick, didn't know they were sick. It was early on in the disease, and they were the spreaders. We want to avoid that. We also want to avoid closing our hospitals, our doctors' offices, our urgent centers, emergency rooms, because we have no one to treat people because they're all sick. And the way to do that is to just pick up the phone if you have a problem and call your physician's office. If you don't have a physician, the county health department has a number for you to call, and they will work at getting you seen. This is very simple. The simplest things we can do are the best things that we can do to deal with this disease. Social distancing, common sense. Don't flood 911 or the emergency rooms or the urgent centers or your doctor's office. Call, and we can get a handle on this.
Okay, folks, that was Dr. Robert Berke, a county physician, and thanks for that information, and it makes good sense. That's what Grandma would have said when we were kids.